We're back live.
All right, Senate Health and Welfare, and we're in the middle of S-186 from the House, so Katie's okay.
Sure. So we're still looking at what is required as part of a exit and transfer policy. So it designates alternative housing arrangements for the resident in the event of an exit or transfer, including contingency plans when alternative arrangements are not available. It needs to describe the recovery residents' substance use policy, which shall exempt the use of a resident's valid prescription medication when used as prescribed. Must indicate that by signing a residential agreement, a resident acknowledges that the recovery residence may cause the resident to be immediately exited or transferred to alternative housing if the resident violates the recovery residence substance use policy or engages in acts of violence that threaten the health and safety of other residents. Okay, and now
I've heard from recovery folks that this is really helpful.
so everything we were just looking at in subdivision A is what is in the policy. And now we're going back to our lead-in language. What does it take? And under what circumstances can a recovery residence exit or transfer somebody? So they have to have an agreement, a resident agreement that has all of the language that we just looked at. Also, the recovery residence has obtained the resident's written consent to its residential agreement reaffirmed after seven days. There was a conversation upstairs that when a person first enters a recovery residence, there's sort of a lot to take in. And that it is helpful to go over some of the agreement that they're signing to 7 days later after they've had a chance to settle in. So that's where that language reaffirmed after 7 days comes from. Also, the resident violated the substance use policy and the residential agreement or engaged in acts of violence that threaten the health or safety of other residents. And lastly, the recovery residence has provided or arranged for a stabilization bed or other alternative temporary housing. So those are the 4 elements before a recovery residence, certified recovery residence, can exit or transfer somebody. In subdivision 2, relapse of a substance use disorder resulting in exiting a recovery residence shall not be deemed a cause of the resident's own homelessness for the purposes of obtaining emergency housing. As used in a subsection, we have the definition of recovery residence, and right here is the language I've been referencing, that this specifies that a recovery residence means a certified recovery residence, certified by the health department, an organization approved by the Department of Health, and that is either Vermont affiliate of the National Alliance for Recovery Residents or another approved organization. So that's referencing VTAR. Then you have a reporting requirement. So on January, on or before January 1st of 2025 and 2026, a recovery residence is to report to the certifying body for recovery residents any exit or transfer of a resident by the recovery residence in the previous year and the asserted basis for exiting or transferring the resident. Then by January 15th, so 2 weeks later, that certifying body for recovery residents is to report that information to the health department. And then 2 weeks later, February 1st, the health department is submitting that data to the General Assembly.
So it doesn't say how, so we can ask for presentations.
If you wanted to, yes, this doesn't say how, you're accurate, that's correct. So you could, if you want a written report, you could specify if you don't feel strongly, you can leave it as is.
This says report.
She'll submit the data received, yeah. So the idea is that the data is going recovery residents, certifying body, health department, General Assembly. So there's sort of a flow of like collecting aggregated data.
Isn't the certifying body the health department?
No, not yet. Right now it's VTAR, somebody opts in.
Okay.
The concept behind the bill is that in section 1, you're asking the health department to develop a proposal for a certification program that they would operate. But that is not in existence yet, so they're gonna come back with a proposal.
Okay.
Yes.
Remember Jeff Moreau and the, yeah.
Yes, in subsection D, the 2025 report shall contain preliminary data from the previous 6 months. 2026 report shall contain data from the preceding year. And then we have a definition of recovery residence that again includes certified. That is specific to certified recovery residences because you're tracking people who've been following this policy. And then we have our sunset. So the previous 2 sections sunset on July 1, 2026. If it turns out that you are back in January working on this and you have a certification program that's ready to be offerable on July 1, 2025, we would just we would amend this language and repeal the year earlier. But otherwise, it gives a 2-year window for legislation to happen on the health department certification program.
So the section 3 goes into effect on July 1st, 2024, and allows for recovery residences to put in place the landlord tenant agreements.
Yeah.
Okay. All right. Questions for Katie on this?
Let's do.
So mandatory certification was never a topic in the original bill that came through, right? It was always an option. That,
Right, and it still is.
yeah, I know that still
Yeah.
is. I'm just
Yeah.
wondering, I just trying to get an
Wanted to
idea of what potentially changed coming back from the house and just, it's been a couple of weeks since we've dealt with this topic.
Sure.
Right, so,
Your language didn't specify that it was voluntary, but the conversations that you had indicated that had been the thinking that the certification would be voluntary, so the House has added that language to make it clear, but it seems to reflect the conversation that happened in this committee.
right.
And just to help me out a little bit, why not have certification?
Well, right now, we've got recovery residences that work under different umbrellas, and so it's really important, I think, that once a certification program is established, then those organizations can decide, are they going to be under PAR? Are they going to be under, they want to go with a new certification program, or they want to stay independent and not? So there are different kinds. Very private organizations where you pay a lot of money and you go in and then you leave after 10 days and you come back in 3 months. So I think of the revolving door issue that is being somewhat resolved in section 3. But I just think this is the time for us to do an assessment of what's there. Keep it fluid for now, and then as we go forward, if we find problems, we can always make it mandatory or keep it. I don't know what you want to add to that, Katie. Just so many different possibilities.
The peer recovery coaches and the peer
Yeah,
that certification is also not mandatory. It is tied in with Medicaid reimbursement.
that.
Is that at all at play in this bill? Because I can't remember.
No. Questions? Any other questions for Katie? It is up there, sitting on the calendar. I'm fine with what the House has done after looking through and then hearing Katie's discussion of the differences. Anybody have significant issues with what's here?
I defer to all of you.
You don't have, you can't.
I don't want.
You're trusting, so.
It looks good.
You can say yes.
Sure.
So are we okay with this then? We'll take it up on the floor and the committee is in agreement that we would concur with the proposal, House proposal of S-186. This is a really important bill. And people keep talking about, finally, keep talking about recovery centers. It's good. All right.
Motion,
I don't know. Do we usually vote on these things?
I believe so.
Okay,
Taking
well, let's
the
vote.
formal
It's a vote, but is it a?
Stance on the House proposal.
Okay, we should do that.
I'm sorry.
We've been doing that. We'll do it. Offers reassurance.
And someone, I don't know, maybe. Oop. Gonna take a minute.
I guess
Hmm,
I moved to,
okay,
to
anybody want to second it?
just my team.
I'll second, yes,
Okay, my team did second it.
definitely, you're the mover. Help people who have been working under Robert's rules forever, now who are in our room all the time.
Oh, yeah,
They
they
know
know.
joke that we have to make that part of the. So this is S-26 draft.
This is S-186, House Proposal of Amendment, which is a strike off. It makes it simple.
We start with Vice Chair Weeks.
Yes.
Senator Gillen, yes. Senator Hardy. I guess, sure, because I can't abstain. So Senator Williams.
Yes.
And Chair Lyons.
Yes.
Another 5-0. Okay, wonderful. Who wants to be the reporter?
Oh, I'll do it. It's usual for the chair to do the concurrence unless she or he says, please help. This one I'm good with. It was my little deal. That's good, thank you.
I know.
Thank you, Katie.
Yeah.
So just as a heads up, our proposal of amendment on H-121 is, PRA is being looked at in judiciary this morning. I sent Senator Sears the proposed amendment. We'll see what judiciary has to say about it. And then I also sent it to Senator Hinsdale. And she'll be looking at it from their perspective, but we'll just see how it goes. We have our proposal of amendment, and should it not change, then I'd be asking you to remember will you have it? And you can decide to sign on. I think Senator Hardy and Senator Gulick have already signed on. If you want to look at it,
I did look at it. I didn't have time for
No, it's
three,
okay.
but I did. So I won't. Decide.
Okay.
Just get to
You don't want that, okay, we're good then. And we'll, good then.
I just, started reading through it from page one. I only realized it was a gray highlighted block on like page 18, which had like the core of the, I'm like, oh, okay.
That's it, that's all we did,
I didn't know.
pages 16 through 18 with the PRA.
Yeah.
And that's what judiciary is looking at.
Yeah, right.
If they are fine with it, I'll be fine with it. If they think it's egregious, then we'll have to take another step back, see how it goes. Well, that's it.
You wanna do a couple of,
Let's do
appointments?
appointments.
just knock them out?
I think we had one appointment, from the Fremantle Care Board. The paperwork somehow has vanished into the ether. So, but it is for Robin Lunge, and we did do another appointment for her. And Senator Hardy, you have information about Robin Lunge that you can maybe help us with?
Yeah, let me.
I'm gonna
pull
just,
it up.
I'll let that one happen first.
Yeah, let me find that stuff. I also have 2 other appointments that I
Good.
finally spoke to.
Three non-airport?
Yeah.
Yeah, number 7. You see Ryan, or Robert Torquay? I sent you an email about it.
Oh, okay. That's fine,
I got a copy of it.
okay.
He's excited to be doing it again, so definitely not soon.
Anybody know what H-2626 is?
626.
It's 626.
It's on animal welfare. Are you getting emails about it? It's maybe hopefully gonna go to your other committee.
It's in a pros probably.
Yeah, it's in finance right now, but it also has to go to a pros.
I'm gonna go grab coffee.
Can I just ask you before you disappear, you're
Yeah.
Judith Scott?
Yeah, I remember I called her, it was months ago.
Yeah, no, I saw there was I know it's approved by the committee, but did it go through the Senate? Did it go through?
No, did you bring it up?
No.
Oh, yeah, you have to bring up the sheet signed.
Well, no, because I was waiting for us to do this.
Oh, okay, we
Yeah.
never approved it. Okay,
Yeah, we haven't done any approvals.
all right, are we doing this then?
Yeah, we are. I would talk to Vice Chair.
Oh, Vice Chair, should I give you mine?
Yeah, want to do a quick verbal?
Sure, I have two, and I'm trying to find the report on Rob and Lunch from last session, but, so I had, Rob, Campanelli, who was a public member appointee to the Board of Medical Practice. I had a nice conversation with him, and have a copy of his lengthy CV. He's mostly retired at this point, but he's worked actually in the pharmaceutical industry for many, many years as a consultant and as a sort of policy person and trainer, and he'd pretty much done a ton of stuff in various pharmaceutical companies and consulting firms. He now is mostly retired. He lives in Warren. He's a super nice guy. He also is the chair of the Neck of the Woods Child Care Center Board, which I thought was lovely. He was excited about all the work that the Board of Medical Practice does. He thought that the three aspects that they work on, policy, licensing, and enforcement, are really a great mix of things. I learned a lot about what the board does talking to him. And he took over someone's term, so he's been there for like 9 months. But so this is his first real appointment. And I think he seemed like a great member of the board. And so I would recommend approval of him. I also talked with David Coder, who is also an appointee on the Board of Medical Practice and also is a relatively recent appointee. He is a family physician from Morrisville and is semi-retired. He has been a family physician for, I think, 40 plus years. And now he's semi-retired and does this, but still works in his practice at QHC 1 day a week. And so he is a physician member of the board. There are public members and physician members. He was great as well. And I thought it was really interesting talking to the two of them and the different perspectives. And so I would recommend that both for the appointment.
You have a
Sure.
copy of that from the council.
Should we just vote?
Yeah.
Okay, just before we go to the next. Yeah.
Okay, you want to,
Can I do next, cause I gotta go run down
Yeah,
the
yeah.
site to move on.
and then the third one is Robin Lunch, who's a reappointment to the Green Mountain Care Board. She has been on the care board for longer than I think anyone at this point on the board. She's a senior, the dean of the board, I guess. And she used to work for the legislature and has been more involved in healthcare, finance, and policy for many, many years. She's incredibly knowledgeable policy analyst and a real asset to the board. And we just reappointed her last year. And definitely.
Is there a characterization of the type of member that she is on the board, like an MD or a
She is,
public or?
Policy.
she's she's not a doctor, but she's a healthcare
JD.
policy expert. She's a lawyer. And she has a lot of historical knowledge on healthcare reform in the state and just a great analyst, policy analyst. I've learned a ton from her. I definitely recommend.
She also
her
worked at
reappointment.
in Washington DC at the budget, budget and finance.
CEO.
budget office for,
Congressional Budget Office.
healthcare.
Yeah.
So she's got a real interesting experience.
Yeah, she's great. So I recommend all three of them. So I would make a motion that we approve the appointments or reappointments of Robert Capanelli to the Board of Medical Practice, Dr. David Coder to the Board of Medical Practice, and Robin Lunge to the Green Mountain Care Board.
A second.
Just do a hand vote. Yeah. All those, all three? Very good. Yeah.
Oh, yeah.
Very good. Thank you.
So Dr. Robert, Cortolani, I contacted him, we finally connected after a couple of times, stated that he's, wondering if he was gonna be asked to participate again. And that he's enjoyed his first tour with the medical practice board, and says a wonderful group of fellow professional members of the board. He's a physician, 82 years old, professor at Dartmouth University. He said he teaches at Dartmouth, so I'll say he's probably a professor. And Dartmouth Hitchcock Medical Center, former president of the Vermont Medical Society. He attended the UVM Medical School as an interim in 1967. In 1969, he knew that Vietnam was going on, he was gonna probably get drafted, so he joined the army.
And they took him.
They took it, and he was a busy guy, surgeon, he's a veteran of the Vietnam War, served in the First Cavalry Division. And although he's now retired, Dr. Tortolani continues to be active in numerous pursuits in Brattleboro, Winton County, in the greater Vermont community since leaving active practice in 2017, and including leading a weekly veterans group, running a free clinic, teaching medical students, and speaking to various historical society groups. So it's a pleasure to interview him, and I would recommend it.
I'll second that.
All in favor?
You want that?
No, you keep it, you're gonna report them on
Okay.
the board if you need to do that.
I got it.
Yeah.
I have
My
to
only
go on.
concern is many of these people are on the senior side.
Yeah.
I know,
Let's go on.
yeah.
They have experience.
Dawn Gilbert.
Just to let you know that Dr. Tongo, who I supported, is not on the senior side.
No, that's good.
And she represents the diversity as well, so. Dawn Filbert, I haven't heard from, but I did hear from her last year, so let's just say yes. This will be the same,
All those favor?
okay,
Sure,
Okay, I'm gonna represent, I have two.
okay.
I'll do them quickly. They're both stellar. So these are both Board of Medical Practice. First one is Dr. Rick Hildebrand. Rutland Regional Medical Center, Rutland Regional Medical Center, Chief Medical Information Officer, past almost 5 years. Medical Director, Hospital Medicine, again, Rutland Regional Hospital, 9 years. Chairman, Department of Medicine, 4 years. Chair, Section of Medicine, 10 years. Vermont Board of Medical Practice, 5 years. Chairman of the board, presently. He's a clinical assistant professor at UVM for the past 5 years. Education, started out UMass MBA, then Dartmouth Hitchcock Medical Center residency, Drexel University College of Medicine, Boston EU Master of Arts Biotechnology, and BA Biochemistry. Volunteer Secretary of Board of Directors at the Community Health, the Community Care Network. These are all very familiar. Rutland Autism Family Group and race organizer for the Rutland Regional Medical Center 5K. And anyway, good guy, totally on board. All those,
I know.
okay.
are we supposed to raise our hands?
Second,
Wait for a second.
second person again, Board of Medical Practice.
Don't go into the giggle bit.
I'll try not to. It's early, so I'll be fine. Later in the day, I don't know.
On the floor.
So this is Dr. Evan Kyler, psychiatrist, professor, specialization in family medicine, specialty care, psychiatry, adolescent medicine, consultant liaison psychiatry, UVM now associate professor of psychiatry and family medicine, board certified in psychiatry, psychosomatic medicine, family medicine and adolescent medicine, a graduate of the University of Michigan Medical School, and the family medicine at the University of Michigan, psychiatry at Dartmouth Hitchcock Medical Center. You'll get, you guys will like this, but, specialization includes, or interests include consultation psychiatry in primary care and gender and sexuality concerns, particularly transgender. Written a book, Principles of Transgender Medicine and Surgery, and gay, lesbian, bisexual, transgender aging challenges in research, practice, and policy. That didn't get your attention. Well, anyway, that's the something.
But I had to say, the diversity that we're hearing on the board is really important. The one question that pops up as we're listening to all of this is what kind of orientation board members are receiving regarding some of their own areas of expertise from them, but also telemedicine and how that's playing out in the work of the board. At some point, we might want to just have that conversation.
Can I quickly do my person?
Yeah.
Judith
Did we vote on?
Yeah, we did it.
Okay.
Yeah, we've already approved her.
No.
Just for some reason, we didn't, yeah, we didn't.
Never voted.
Two.
I don't remember. We can
Yeah,
vote
go
again.
ahead, go to me.
Mine will be quick, but I had a short but nice conversation with Judith Scott on the phone, and then I also spoke with her husband, and she was very impressed that a Vermont senator was calling her to see if she wanted to continue on the Board of Medical Practice. She's a public member, and her background is in the Vermont Refugee Resettlement Program, so she brings an equity lens and I would recommend her.
Yeah, so,
Awesome.
you did that.
I don't know.
Let's do it again. This is good.
Very good.
Double.
Okay, now, process.
That's why you first.
So process wise, Kiki.
Are you, wait, hold it,
Sorry.
hold it.
Sorry.
Relax. Process wise, each person needs to have the piece of paper that belongs to your people that you're taking upstairs. And then you take it upstairs and hand it into the secretary's office with your name on it and our vote. That's it. And I know Bill Hobbs is in charge of this. So
I just wanna make sure that all of our
Robert?
things get done.
And so we just.
boy, you are a taskmaster.
She
I
is.
am.
I know.
April
We
Garrett?
want to be out of here on Friday, right?
Well, I just want to, especially given everything, I don't have
April.
any kind of
Things,
No.
yeah.
The one you do not have then will need to be negotiated with the secretary's office.
I don't know. Just ask.
The Robin one.
This is Rob.
They need a copy.
I
of
do
the
have the
write-up.
Robin one.
Evan?
Keep it for yourself.
Oh,
Because when you're
Just
called,
bring that to them.
I think you do have to sign these and put a vote on them.
Okay, everybody's got their paperwork.
We
Everybody
do
happy?
not have one for Robin Lunch though.
we don't have one.
No, I didn't get
It was sent here on January 3rd, according to the secretary. So it didn't reach us. Well, what we might ask Kiki to do is to reach out to the governor's office and ask them for another copy of that, or perhaps it's in the secretary's office. I was gonna try secretary first, then try governor's office.
Thanks, Kiki.
So just signing and dating the bottom.
Today was 7.
Good.
And I don't think any of these except for Robin need a actual report. on
No,
the floor.
but it's good to be prepared. Just in case.
Okay, if I sneak out to Greg, secretary.
We're finished.
Okay.
Good, thank you, Warren.
Thank you.